Hello, everyone. Welcome to Pattern Differentiation according to Zhangfu organs. Today, we will discuss the spleen and stomach patterns. The spleen is located in the middle jaw, and it has an exterior-interior relationship with the stomach. The spleen controls the muscles and the four limbs. It opens into the mouth and manifests in the lips. The main physiological functions of the spleen are to govern the transportation and transformation or digestion. The spleen transforms the ingested food and drink to extract food chi or nutritive substances from them and supplies the organs and tissues with adequate nutrition for the maintenance of normal physiological functions. Overall, the spleen serves as the source of engendering and transformation of qi and blood and is often called the root of acquired constitution. The spleen has the function of keeping blood within the blood vessels and preventing extravasation. It helps to send qing qi, or the clear yang qi, upward. It likes dryness and loathes dampness. The stomach also resides in the middle jaw, and it governs intake and controls the rotting and ripening of food, so it is called the sea of water and food. Contrary to the spleen, the stomach dominates the sending of qi and likes dampness and loathes dryness. The impairment of transportation and transformation of the spleen may lead to retention of water, which may be condensed into water damp. The spleen qi should ascend. If it fails to ascend, it will sink, leading to diarrhea and prolapse of organs. The common symptoms for spleen dysfunction are abdominal distension, bloating or pain, poor appetite, loose stool, edema, feeling of body heaviness, prolapse of organs, lassitude, bleeding, etc. The stomach receives food and the stomach qi should descend. But if the function of the stomach is impaired, stomach qi will go upward and lead to counterflow of stomach qi. The common symptoms for stomach dysfunction are epigastric distension or epigastric pain, nausea, vomiting, belching, hiccups, and acid regurgitation. The patterns of the spleen can be classified into two types: deficiency type and excess type. The deficiency type is mainly caused by improper diet, overstrain and fatigue, excessive thinking and worrying, or improper nursing care in chronic diseases. The excess type is also caused by improper diet, invading of damp heat or cold damp, delayed treatment, or incorrect treatment. Deficient types are spleen-qi deficiency, spleen-qi sinking, spleen-yang deficiency, failure of spleen in controlling blood. And the excess types are cold damp encumbering the spleen, accumulation of damp heat in the spleen. Patterns of the stomach can also be classified into two types: deficiency type and excess type. The deficiency type is caused by improper diet or overeating, improper nursing care in chronic diseases, excessive vomiting or diarrhea, damage of fluids in the late stage of warm diseases, or blood and fluids deficiency in the elderly. The excess type is due to overeating, improper food, or cold or heat pathogens invading the stomach. Let's discuss spleen-qi deficiency. Spleen-qi deficiency is, alongside liver-qi stagnation, probably the most common pattern one meets in the clinic. This is mainly a consequence of the diet that many people consume and the way in which they eat their food, which often puts a great strain on the spleen-qi. Most patterns of spleen imbalances are simply variations of spleen-qi deficiency. Furthermore, spleen-qi deficiency is often central in the creation of patterns of imbalance in many other organs. Several of these combined patterns become self-generating, where one pattern results in the creation of the other and vice versa. The primary cause of spleen-qi deficiency is consuming food and beverages that are cold in both their temperature and energy, raw foods, and food that is unrefined or damp-producing. Eating too much at a time, eating too quickly, or not chewing the food enough will also burden the spleen. Although eating several small meals is better for the spleen, constantly snacking will also strain the spleen because it will constantly have to transform the ingested food. This pattern is due to spleen-Chi deficiency and failure of transportation and transformation. It is also called spleen failing to transform and transport. Key symptoms: abdominal distension, poor appetite, loose stool, along with the Chi deficiency pattern. Clinical manifestations: abdominal distension or bloating, especially after meals, poor appetite, lack of ability to taste foods, loose stool, lassitude of the body and limbs, fatigue, lack of strength, shortage of Chi, laziness in speaking, emaciation, sallow complexion or obesity, edema, a pale tongue with a white coating, a moderate and weak pulse. This pattern is usually caused by irregular diet, overstrain, fatigue, damage, overthinking and overworrying, impairing the spleen, hereditary weakness, deficiency with old age, or improper nursing care in severe diseases. Spleen-Chi can also be weakened by excessive worrying, speculating, studying, and ruminating. Prolonged illness, excessive bleeding, and overexertion are also a burden on the spleen because it has to replenish the Chi and blood that have been consumed or lost. Chronic liver Chi stagnation will often lead to a disturbance and thereby a weakening of spleen Chi. Finally, living or working in a humid environment can strain the spleen because the spleen abhors dampness. Etiology is excessive consumption of cold and raw foods which hinder the spleen, irregular eating and eating too much, excessive mental activity, anxiety, prolonged exposure to damp, chronic illness. Underlying or accompanying pathology: stomach Chi deficiency, spleen-Yang deficiency, lung Chi deficiency. Signs and symptoms: poor appetite, abdominal distension after eating, tiredness, pale or yellow complexion, pale or dark lips, dizziness, low voice, shortness of breath, weakness of the limbs, loose stool, slight depression, tendency to gain weight. Pulse is empty, tongue pale, thick coating. Treatment principle: supplement the spleen, warm the lower burner. Acupuncture treatment: Ren 12 to fortify stomach and spleen. Spleen 3, Yuan source point of the spleen, bladder 20 to supplement spleen Chi, chronic. Ren 4 to supplement the Chi. Stomach 36, supplement spleen Chi. Spleen 6 also supplements the spleen Chi. Bladder 21 to supplement stomach and spleen Chi. Ren 6 to warm the lower burner. We needle with supplementation and moxa. Dietary changes are alpha and omega in the treatment of spleen-Chi deficiency. This encompasses both what is eaten and how it is eaten. A person who is spleen-Chi deficient should eat as much prepared and warm food as possible. They should avoid raw vegetables, salads, food that is very coarse, cold drinks, ice cream, and food that generates dampness, such as sweets, dried fruit, artificial sweeteners, honey, stevia, dairy products, bananas, avocados, and so on. They should avoid eating too quickly, too much at a time, and while reading, watching television, or working. They should chew their food well and avoid drinking too much at meal times. They will benefit from eating soups, mashed vegetables, purees, porridge and morning, stews, steamed or boiled vegetables, and baked vegetables. That is food that is easily digestible and preferably warm. The weaker their spleen Chi is, the more digestible their food should be, as long as it does not create dampness. Drinking a small cup of ginger tea at mealtimes will help to fortify spleen Yang, thereby assisting the spleen in its transformation of the food. The use of herbs in the diet, especially aromatic spices like black pepper, ginger, cardamom, garlic, cumin, caraway, and nutmeg, will also assist in circulating Qi, dispersing food stagnation, and transforming dampness, thereby alleviating the burden on the spleen. Foods that are particularly beneficial are rice, oats, barley, most vegetables, especially root vegetables, squash, sweet potatoes, and those that are yellow or orange in color, red lentils, tofu, chickpeas, and chicken. It is important that the person does not regularly sit still for extended periods of time and that they do not sit in a slump posture. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial as long as the person does not overexert themselves. Stroking downwards with the fingers from REN 16 to REN 8 will help stomach chi to descend. Meditation is interesting in the context of spleen chi deficiency. Often we recommend yin activities like meditation rather than physical activity when there are chi deficiency conditions. However, meditation where you sit still for long periods of time can burden the spleen, and excessive mental focus can consume spleen chi. This does not, though, mean that meditation in itself is negative when there is spleen chi deficiency. It just requires taking certain factors into consideration. If you're able to meditate with an empty mind, then it will be beneficial. Meditation is also an excellent tool to reduce the tyranny of worry, speculation, and repetitive thoughts. Walking meditation will generally be a better option for a person who is spleen chi deficient, as walking circulates chi in the middle jiao, while sitting still can cause chi to stagnate in the middle jiao. Sinking of spleen chi. Spleen chi sinking is almost the same as spleen chi deficiency. The difference between the two patterns is that when there is spleen chi sinking, there are specific symptoms that relate to spleen chi failing to carry out its function of lifting and holding organs and structures in the body in place. This can manifest in anything from a mild dragging sensation in the body to a prolapse of organs or structures. For example, hernias and rectal prolapse. Spleen chi is also needed to hold the fetus in the uterus during pregnancy. Spleen chi sinking can therefore also manifest with spontaneous miscarriages. This is due to spleen chi deficiency failing to raise the chi upward, leading to chi sinking. It is also called middle jiao chi sinking pattern. Key symptoms: bearing down sensation in the abdomen and prolapse of internal organs with symptoms of spleen chi deficiency. Clinical manifestations: these include a bearing down sensation in the abdomen, distension in the epigastrium and abdomen, especially after meals, frequent and urgent defecation and chronic diarrhea, a bearing down sensation of the anus, prolapse of the rectum or uterus, and turbid urine. These symptoms usually are accompanied by a shortness of breath, lack of strength, lassitude, and laziness in speaking, dizziness, lusterless, whitish complexion, poor appetite, loose stool, a pale tongue with a white coating, and a moderate and weak pulse. This pattern is mainly caused by further development of spleen chi deficiency, by chronic diarrhea or chronic dysentery, overstrained fatigue damage, or by excessive childbearing and improper nursing care after childbirth, all of which consume the spleen chi. Apart from the relevance of the same etiological factors that can result in spleen chi deficiency, factors such as repetitive lifting of heavy objects will weaken kidney yang, which supports the spleen in its function of lifting and holding things in place in the body. Spleen chi sinking is also called center chi fall. Etiology includes excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, excessive mental activity, standing for long hours every day, childbirth, menopause, prolonged exposure to damp, chronic illness. Underlying or accompanying pathology: spleen chi deficiency, stomach chi deficiency, lung chi deficiency. Signs and symptoms: poor appetite, slight abdominal distension following food, pale complexion, tiredness, weakness of the limbs, loose stools, depression, tendency to gain weight, bearing down sensation in the abdomen, prolapse of stomach, uterus, anus or bladder, frequent and urgent urination in infants, depressed fontanelle. Pulse is empty or weak. Tongue is pale. Treatment principle: supplement the center and boost the chi, raise the yang, and rectify the fall. Acupuncture treatment: REN 12 to supplement spleen chi, spleen 3, the yuan source point of the spleen, bladder 20 to supplement the spleen chi, chronic cases, do 20 to raise the chi, stomach 21 to supplement the stomach, rectify prolapse of the stomach, do 1 for prolapse of the anus, stomach 36 to supplement spleen qi, spleen 6 to supplement spleen qi, bladder 21 to supplement stomach and spleen qi, ren 6 to supplement and raise qi. Needle with supplementation and moxa. As well as following the advice that is recommended when there is spleen qi deficiency, it is important that the patient avoids heavy lifting. Next, we talk about spleen-yang deficiency. Spleen-yang deficiency is often a development of spleen qi deficiency, but it can be the consequence of other imbalances. The symptoms and signs that define this pattern are very similar to those seen when there is spleen qi deficiency. There will, though, also be signs of deficient cold in this pattern. This is due to spleen-yang deficiency failing to warm and transport and transform and generating interior cold symptoms. It is also called a deficiency cold pattern of the spleen. Key symptoms, qi deficiency symptoms, and deficiency cold symptoms. Clinical manifestations, poor appetite, abdominal distension, abdominal dull pain, which can be relieved by warmth or pressure, cold limbs, shortage of qi, fatigue, lack of strength, white complexion, a bland taste in the mouth, no thirst, loose stool, general edema, scanty urine or profuse dilute and white leukorrhea, a pale and plump tongue with or without teeth prints, a white and slippery coating, and a deep, slow, and weak pulse. This pattern is mainly caused by the further development of spleen qi deficiency, by excessive intake of raw and cold food, by excessive intake of cold or cool medicines damaging the spleen yang, by kidney yang deficiency failing to promote the spleen, or by insufficient Mingmen or life gate fire, leading to failure of generating fire in earth. Etiology of spleen yang deficiency, prolonged exposure to damp, excessive consumption of cold raw foods which hinder spleen, irregular eating and eating too much, excessive mental activity, chronic illness. Underlying or accompanying pathology, spleen qi deficiency, lung qi deficiency, kidney yang deficiency. Signs and symptoms, poor appetite, slight abdominal distension after food, bright white complexion, tiredness, weakness of limbs, loose stools, tendency to weight gain, feeling cold, cold limbs, edema, fatigue spirit, physical cold, abdominal pain relieved by warmth, pressure, diarrhea containing untransformed food. Pulse, deep, weak, slow, forceless. Tongue is pale, swollen, wet with white coating. Treatment principle, fortify and warm spleen yang, disinhibit water. Acupuncture treatment, REN 12 to fortify stomach or spleen. Spleen 3, Yuan source point of the spleen. Bladder 20 to supplement spleen qi. In chronic cases, spleen 9, resolve damp in the lower burner, bladder 22 to supplement spleen, resolve edema, ren 6 to warm the lower burner, stomach 22 to regulate intestines, stomach 36 to supplement spleen qi, spleen 6 to supplement spleen qi, bladder 21 to supplement stomach or spleen qi, ren 9 to supplement spleen, resolve edema, stomach 28 to supplement spleen and resolve edema as well, ren 11 to harmonize middle burner, ren 4 to supplement qi and yang. We needle with supplementation and large amounts of moxa. The advice given for spleen yang deficiency is the same as that given for spleen qi deficiency. When there is spleen yang deficiency, it is even more important that the person avoids food, beverages, and drugs that are cold in their energy or temperature, as well as consuming things that have a warming energy, such as cinnamon, ginger, cloves, lamb, and so on. Let's now talk about spleen failing to control blood. This is also called spleen qi not holding blood inside the vessels. This is again a variation of spleen qi deficiency. In this pattern, the spleen is not able to perform its function of keeping blood inside the vessels. This will manifest in bleeding and bruising. The bleeding can take many forms. It may be different kinds of menstrual disorders, such as mid-cycle spotting, heavy menstrual bleeding, or prolonged menstrual bleeding, or there may be nosebleeds, blood in the urine, or blood in the stools. It is, however, important to remember that spleen chi not holding blood inside the vessels is just one of several patterns that can result in bleeding. Bleeding can also occur when there is deficient or excess heat and when there is blood stagnation. There will usually be a combination of more than one pattern at a time. Furthermore, it is important to remember that these patterns will lead to the development of blood deficiency over time. Milder cases of spleen chi not holding blood inside the vessels are seen in people who have a tendency to bruise easily. Concept, this is due to spleen chi deficiency, failing to hold the blood in the vessels and causing extravasation of blood and hemorrhage. It is also called chi unable to hold the blood. Key symptoms, hemorrhage and spleen chi deficiency symptoms at the same time. Clinical manifestations, hemophagia or blood in the stools, hematuria, blood in the urine, gingival bleeding, epistaxis, nose bleeding, petechiae, hemorrhage into the skin, menorrhagia, excessive menstrual flow, metrorrhagia, bleeding from the uterus that is not associated with menstruation, uterine bleeding that is often accompanied by a pale complexion, lusterless skin, a poor appetite, loose stool, fatigue, lack of strength, shortness of breath, laziness in speaking, a pale tongue, a white tongue coating, and a thready and weak pulse. This pattern is usually caused by weakness of the spleen after a chronic disease or by overstrain, which damages the spleen. This is called fatigue damage, both of which lead to failure of the spleen in controlling blood. Symptoms of spleen chi deficiency plus bleeding. This is blood is extravasated to intestines, causing bloody stools to the bladder, causing bloody urine to the subcutaneous region, causing blood spots on the skin, to the skin pores, causing hematohidrosis. The chong and ren are not consolidated, causing menorrhagia and uterine functional bleeding. The hypofunction of the spleen in transportation and transformation leads to a poor appetite and loose stools. Listlessness, shortness of breath, and inactive talking come from a deficiency of qi of the middle burner. Repeated bleeding causes blood deficiency, which results in a sallow or pale complexion. A pale tongue and thready forceless pulse are the signs of qi deficiency. Etiology of spleen failing to manage the blood, excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, a diet lacking in protein, excessive mental activity, prolonged exposure to damp, chronic illness. Underlying or accompanying pathology is spleen chi deficiency. Signs and symptoms, poor appetite, slight abdominal distension after food, tiredness, weakness of limbs, pale and sallow complexion, weak and fatigued spirit, loose stools, tendency to obesity, petechiae, blood in urine or stools, excessive uterine bleeding, dizziness, heart palpitations, shortness of breath. Pulse, weak or fine, tongue is pale. Treatment principle, boost qi to contain blood. Acupuncture treatments, REN 12 to supplement stomach and spleen. Spleen 3, yuan source point of the spleen. Bladder 20 to supplement the spleen qi in chronic cases. Do 20 to raise the yang, nourish the marrow. Bladder 17 to nourish or harmonize blood. Spleen 1 to strengthen spleen, stop uterine bleeding. Stomach 36 to supplement spleen qi. Spleen 6 to supplement spleen qi as well. Bladder 21, supplement stomach or spleen qi. REN 6 to regulate qi, harmonize blood. Spleen 10 to help spleen manage blood. We needle with supplementation and moxa. For blood in the stool, we add REN 4 and bladder 35. For flooding or spotting, we add REN 4 and REN 6. The advice given in the section on spleen qi is also relevant here. Next is cold damp encumbering the spleen. This pattern can be both acute and chronic. If it is an acute pattern, it will be due to an invasion of exogenous pathogenic qi. It will, however, still be classified as an interior imbalance because the pathogenic qi is located in the interior. Damp cold can invade the spleen when a person has been living or working in a cold and humid environment, has been wearing wet clothes, or has been consuming medicine, food, or beverages that are cold and damp in either their temperature or energy. Damp cold can also invade the body via the spleen channel in the feet and legs if the person has walked barefoot on cold and damp surfaces or has worn shoes that are not warm and dry enough. This is due to interior exuberance of cold dampness encumbering the spleen and disturbs the spleen yang. It is also called dampness encumbering spleen yang or cold dampness obstructing the middle jaw. It is seen at the tie-in stage of the 6-channel patterns. Key symptoms, symptoms of functional impairments of the spleen and stomach in transforming and transporting with manifestations of interior exuberance of cold dampness at the same time. Clinical manifestations, fullness and distending pain in the epigastrium and abdomen, a bland but slimy taste in the mouth, poor appetite, nausea, vomiting, absence of thirst, abdominal pain, loose stool, heaviness of the head and body, edema, scanty urine, smoky yellow skin and yellow sclera, profuse leukorrhea, an enlarged tongue with a white greasy or white slippery coating, a soft or deep and thready pulse. This pattern is mainly caused by improper diet, excessive intake of raw or cold foods, by exposure to a cold and damp environment like living in a damp or rainy place, or by other excessive endogenous dampness. Coming into contact with certain bacteria and viruses can result in damp cold conditions. This can be anything from eating food that has gone off to cholera. This is because a pattern of imbalance is defined by its symptoms and signs. If the symptoms and signs are those that are seen in damp cold, then that which has caused the imbalance will, by definition, be damp cold in nature and will be treated accordingly. Etiology of cold damp invading the spleen, exposure to exterior dampness from either weather or living conditions with spleen deficiency underlying, allowing damp to invade. Signs and symptoms, poor appetite and digestion, fullness and oppression in the stomach, duct, and epigastrium, which is better for warmth, heaviness in the head and limbs, sweet or sticky taste or absence of taste, no thirst or thirst for warm drinks, loose stools, leukorrhea, tiredness, dull white complexion, pulse slippery and slow, tongue swollen, pale with sticky white coat. Treatment principle, warm the center, dispel cold, and disinhibit damp. Acupuncture treatment, spleen 9, to drain damp in the lower burner, Ren 12 to supplement spleen, disinhibit damp, stomach 8 to transform damp in the head, bladder 20 to supplement spleen, resolve damp, Ren 11 to harmonize the middle burner, spleen 6 to disinhibit dampness, spleen 3 to supplement spleen chi, bladder 22 to harmonize spleen and stomach, Ren 9 to harmonize intestines, stomach 22 to regulate intestines, needle with supplementation and large amounts of moxa. A person with cold damp invading the spleen should avoid food and beverages that are cold, both energetically and in their temperature. They should also avoid consuming anything that produces dampness. This means that dairy products, cold drinks, ice cream, sweets, cake, dried fruit, with sugar, lettuce, cucumber, tomato, melon, and tropical fruit should be avoided. They will benefit from consuming foods that are cooked, baked, and roasted and have a warming energy. Ginger will be particularly good as it is warming, but also spicy and thereby expels exogenous pathogenic qi. Keeping the abdomen warm and dry is also vital in this pattern of imbalance. We now talk about retention of damp heat in the spleen. The major difference between this and damp cold invading the spleen is the presence of heat symptoms and signs. Like damp cold invading the spleen, this pattern can be both acute and chronic. An acute condition will occur when there is an invasion of exogenous pathogenic qi, whereas a chronic condition is usually the result of spleen qi deficiency, creating dampness, or consuming food and beverages that create dampness or damp heat. Dampness, when it stagnates, will generate heat and transform into damp heat. This process is accelerated if there is already heat present in the body. This will typically be liver qi stagnation heat. This pattern is often characterized by there being a chronic condition of latent damp heat, which flares up every time food or beverages are consumed that generate damp heat or damp heat. In general, the symptoms will be milder and less pronounced when there is a chronic condition. This is due to accumulation of damp heat in the middle jaw, leading to disturbances of the functions of the spleen and stomach in transporting and transforming. It is also called damp heat in the middle jaw or damp heat in the spleen and stomach. Key symptoms: functional impairment of the spleen and stomach in transporting and transforming, along with retention of damp heat at the same time. Epigastric fullness, nausea, and sticky yellow coating are enough to diagnose damp heat in the stomach. Clinical manifestations: fullness in the abdomen, poor appetite, nausea, loose stools with a foul odor, heaviness of the body and limbs, thirst with desire for drinking in small sips, rising and falling fever, which cannot be relieved after sweating, jaundice of the skin and sclera with a fresh, bright yellow color, itching, a red tongue with a yellow sticky coating, and a soft and rapid pulse. This pattern is caused by invasion of a damp heat pathogen or excessive intake of acrid, warm, fatty, sweet foods or alcoholic drinks which produce damp heat. Invasions of exogenous damp heat, such as the ingestion of contaminated food, living or working in hot and humid conditions, and direct contact with viruses, bacteria, and other pathogens that have a damp heat nature. The excessive intake of foods that have damp heat generating energy can be both a root cause and an aggravating factor. Damp heat can often arise as a consequence of chronic spleen qi and damp conditions. Dampness obstructs the middle burner and prevents the descending of stomach qi. This causes nausea and a feeling of fullness of the epigastrium. Dampness is sticky, hence the sticky taste and sticky tongue coating. A feeling of heaviness is caused by dampness as this obstructs the muscles. The blocked nose and yellow nasal discharge are due to dampness in the stomach channel on the face. This is a common cause of chronic sinusitis. The heat part of damp heat causes a thirst, but the obstruction of the middle burner by dampness makes the patient reluctant to drink. This may seem a strange symptom, but patients do report it. The dull yellow complexion and slippery pulse reflect dampness. Damp heat in the stomach frequently causes symptoms on the face due to stomach channels such as facial pain and nasal discharge, as in sinusitis. So damp heat in the spleen, etiology: exterior damp heat, eating contaminated or unclean food, possible background spleen qi deficiency. Signs and symptoms: fullness of the epigastrium and lower abdomen, epigastric or abdominal pain, poor appetite, feeling of heaviness, thirst without desire to drink, nausea, vomiting, loose stools with offensive odor, yellow urine, heavy, cumbersome limbs, tenesmus, feeling of heat, low-grade fever unabated by sweating, headache, bitter taste, yellow sclera. Pulse: slippery and rapid or soggy. Tongue is red with sticky yellow coating. Treatment principle: clear heat, resolve dampness, and regulate the intestines. Acupuncture treatment: spleen 9 to resolve lower burner damp heat, do 9 to resolve damp heat, bladder 20 to resolve dampness, ren 9 to harmonize the intestines, stomach 22 to regulate intestines, bladder 22 to regulate spleen and stomach, stomach 25 to regulate large intestine, spleen 6 to resolve damp heat, LI 11 to clear heat and resolve damp, GB 34 to resolve damp heat, ren 11 to harmonize middle burner, stomach 28 to regulate lower burner, and LI 4 to clear heat. For yellowish or yellowing of the body or eyes with drained liver 3 and GB34. For itchy skin, add spleen 10 and Qi Yang. For pronounced heat, drain Do 14, prick Li1 to bleed. Needle with drainage, no moxa. It is essential that the person with chronic damp heat invading the spleen avoids, as far as possible, food and beverages that create damp heat, dampness, or heat. It is usually not enough to avoid sugar, sweets, cake, and so on. They should also avoid dried fruits, stevia, artificial sweeteners, and anything else that has a concentrated sweet flavor. Alcohol, hot spices, including chili, pepper, chocolate, and garlic will also be problematic, as will dairy products. While they should avoid things that create damp heat, they should try to consume a diet that is beneficial for the spleen. Let's now discuss stomach cold. This will be an acute pattern resulting from climatic, dietary, or pharmaceutical influences. This is a pattern of interior full cold. It is an acute pattern caused by the invasion of the stomach by exterior cold. The stomach is one of 3 organs with intestines and uterus that can be attacked by exterior cold directly by passing the exterior layers of the body. Exterior cold blocks the stomach and prevents stomach chi from descending, hence the vomiting and the pain. Cold impairs the yang of the stomach and spleen and prevents the food essences from reaching the body, hence the feeling of cold, slow pulse, preference for warm liquids, and aggravation from cold liquids. Stomach cold is due to a cold pathogen invading the stomach and manifests as cold pain in the epigastrium with excess cold symptoms. It is also called cold invading the stomach. Key symptoms: presence of epigastric pain and cold patterns at the same time. Clinical manifestation: sudden epigastric pain, which is aggravated by cold and alleviated by warmth, nausea, vomiting, pain, which is relieved temporarily after vomiting, a bland taste in the mouth, and lack of thirst, or clear drooling, which is excess salivation, pale or blue complexion, cold limbs, a pale tongue with a white moist and slippery coating, and a wiry or deep, slow, and tight pulse. This pattern is mostly ascribed to an excessive intake of raw and cold food, or an attack on the stomach by cold, which leads to cold stagnation in the epigastrium. Exogenous cold can invade the stomach, either via the mouth or through the skin of the abdomen. If the invasion takes place through the mouth, it will be due to the consumption of food that has a very cold temperature or energy. This could, for example, be ice cream, ice water, or other cold beverages, but it could also be due to the consumption of drugs or herbs that have a very cold energy. Invasions of cold via the skin will be due to contact with cold climatic influences, particularly if the abdomen is cooled down by wearing wet clothes. So please note that the clinical manifestations we have just described is the acute stage of an invasion of cold in the stomach. If the cold is not expelled and we see the patient a few weeks or months after the initial invasion, the symptoms will be characterized by empty cold. In this case, the epigastric pain is less intense, the tongue coating less thick, and the pulse less full. As cold injures yang, if the situation persists, the stomach will suffer from empty cold and yang deficiency. That is the pattern of stomach deficient and cold. Therefore, the present pattern of cold invading the stomach may lead to stomach deficient and cold. Etiology for cold invading the stomach is invasion of exterior cold, exposure to cold, excessive consumption of cold or raw foods. Underlying or accompanying pathology: possible underlying stomach chi weakness. Signs and symptoms: sudden severe epigastric pain, feeling cold, preference for warmth, cold limbs, nausea and vomiting of clear fluids that relieves pain, pain worse after drinking cold fluids, preference for warm liquids. Pulse: deep, tight, and slow. Tongue: thick white coating. Treatment principle: scatter cold, warm, and harmonize the stomach, stop pain. Acupuncture treatment, stomach 21 to dissipate stomach cold, REN 13 to stimulate descending of stomach chi, stomach 36, main point to supplement stomach chi, stomach 44 to descend the stomach chi, pericardium 6 to harmonize the stomach, spleen 4 to clear obstruction from stomach, stomach 34 for acute and painful patterns, REN 12 to supplement stomach and spleen chi, stomach 21 to regulate chi and alleviate pain. We needle with even method and moxa. When there is an invasion of cold in the stomach, the person will benefit from eating and drinking food and beverages that have a warming and spicy dynamic and that are thermally hot, such as ginger tea. If the invasion is due to climatic influences or wet clothes, a ginger poultice on the abdomen can help to expel the cold. The person should avoid consuming food and beverages that are cold in their temperature and energy. The upper abdomen should be kept warm and dry. Let's now talk about stomach heat. A burning pain in the epigastrium, which is worsened pressure, acid regurgitation, thirst with a desire to drink cold water, eating a lot but still feeling hungry, foul breath, swelling and painful gums, bleeding gums, constipation, yellow scanty urine, red tongue with a yellow coating, and a rolling rapid pulse. This is a pattern of interior full heat in the stomach. Heat in the stomach burns the fluids, hence the intense thirst, constipation, and dry tongue. Heat makes the blood extravasate in the stomach channel, resulting in bleeding from the gums. The swelling and pain in the gums is due to heat rising in the stomach channel. Full heat obstructs the stomach and interferes with the descending of stomach chi, hence the sour regurgitation, nausea, and vomiting. The fluid regurgitated is sour because the heat ferments the stomach fluids. Excessive hunger is caused by stomach heat. This is due to scorching exuberance of stomach heat and stomach fails to descend. It is also called scorching exuberance of stomach heat or flourishing of stomach fire or stomach phlegm heat. Key symptoms: a burning sensation and pain in the epigastrium with excess heat symptoms. Overeating spicy food produces fire. Emotional depression causes chi stagnation, which affects the stomach. Invasion of pathogenic heat gives rise to excessive stomach fire. A burning sensation in the epigastrium, thirst with a desire to drink cold liquids, and a red tongue with a thick yellow coating are enough to diagnose stomach heat. Clinical manifestations: a burning sensation and pain in the epigastrium, dislike of pressure, thirst with preference for cold drinks, constant hunger, vomiting after eating, halitosis, foul breath odor, or inflammation, painful and bleeding gums, gingival hemorrhage, constipation, scanty dark urine, red tongue with yellow coating, and smooth and rapid pulse. This pattern results from an excessive intake of acrid, spicy, warm, greasy, or dry food, which turns into fire. From emotional frustration, which leads to depression of chi, that turns into fire, or from invasion by endogenous heat pathogens, all of which can lead to scorching exuberance of stomach heat. So there are symptoms of epigastric burning pain plus symptoms of excessive internal fire. A burning pain in the epigastrium is caused by fire in the stomach, blocking its chi and blood. The liver fire overacts on the stomach, causing acid regurgitation. The stomach fire burns body fluid, so there is thirst with a desire to drink cold water. The hyperfunction that brought fire causes one to eat a lot but still feel hungry. The collateral of the stomach distributes to the gums, and the stomach fire goes to the gums, causing swelling and painful and bleeding gums. The turbid chi of the stomach ascends, causing foul breath. Fire consumes body fluid, causing constipation and yellow scanty urine. A red tongue with a yellow coating and a rolling rapid pulse are the signs of heat syndrome. So here you could see the red center on the tongue with coating. This is stomach heat. Okay, the etiology of stomach phlegm fire. Excessive, hot, spicy, phlegm-forming foods, smoking, emotions like prolonged anger, frustration, resentment, depression. Underlying accompanying pathology, spleen chi deficiency, stomach chi deficiency, stomach heat, liver chi stagnation, liver fire blazing, heart fire blazing. Signs and symptoms, burning epigastric pain, bitter taste, thirst but no desire to drink, bleeding gums, mental restlessness, constipation, nausea, vomiting soon after food, sour regurgitation, dry mouth, mouth ulcers, excess hunger, bad breath, feeling of heat, oppression of chest, epigastrium, mucus in stools, insomnia, vivid dreaming, expectoration of phlegm. Pulse is slippery, rapid, slightly overflowing, right middle position. Tongue, red body, deep midline crack. Sticky yellow coating also within stomach crack. Treatment principle, clear stomach and drain fire, harmonize stomach, transform phlegm, nourish yin fluids. Acupuncture treatment, stomach 44 to clear stomach heat, stomach 21 to stimulate descending of qi, REN 13 to subdue rebellious qi, LI4 to regulate face, eyes, nose, mouth, ears, spleen 15 to move qi and regulate intestines, spleen 9 to transform dampness, spleen 6 to supplement spleen or stomach, stomach 34 to harmonize the stomach, REN 12, clear stomach heat, LI 11 to clear heat, REN 11 to harmonize middle burner, stomach 40 to transform phlegm, benefit the chest, REN 9 to harmonize intestines. Needle with drainage. When there is stomach fire, the person should avoid all foods that are hot in their energy. They should eat cooling or neutral foods, especially boiled or steamed vegetables and foods that are moist or glutinous in their consistency, such as porridge. This will help protect the stomach CN aspect. The ingestion of umeboshi plums will have a neutralizing effect on stomach fire and can be used in acute conditions. If food stagnation is involved in the generation of stomach fire, it is important that the person follows the dietary advice for this pattern. Let's now talk about stomach yin deficiency. It is important to remember that this pattern is often seen in combination with other patterns, such as spleen qi deficiency or spleen yang deficiency. This means that some of the symptoms and signs will not be as obvious because they are veiled by the symptoms and signs of the other pattern and vice versa. The stomach is the origin of fluids, and when its yin is deficient, there will be dryness, causing dry stools, dry mouth, and throat, and thirst. The dry mouth in stomach yin deficiency is peculiar insofar as it is with a desire to drink in small sips. Because the thirst is due to deficiency of yin, the person likes to drink in small sips or sometimes even likes to drink warm liquids. The feeling of heat in the afternoon is due to deficiency of yin. The most significant sign of deficiency of stomach yin is a tongue that is either without coating or has a rootless coating in the center, the stomach area. This is due to the insufficiency of stomach yin failing to moisten and nourish the stomach. If a deficiency heat pattern is not obvious, it is also called a stomach dryness pattern. Key symptoms, common symptoms of stomach diseases, and the symptoms of yin deficiency. Even just the absence of coating in the center of the tongue is enough to diagnose stomach yin deficiency. Clinical manifestations, dull pain in the epigastrium, anorexia, fullness in the epigastrium, no appetite or intake of food, but indeficiency with stomach heat results in swift digestion with increased appetite. Retching, hiccups, dryness of the mouth and throat, dry stool, scanty urine, a red tongue with little moisture and diminished or no coating, and a thready and rapid pulse. This pattern is mainly caused by the consumption of stomachache by febrile diseases, by emotional frustration leading to depression of qi, which then turns into fire to injure stomachache, excessive vomiting or diarrhea consuming body fluids, by excessive intake of acrid, spicy, or hot foods, by eating too late in the evening, or by taking too many warm herbs consuming stomachache. Eating irregularly, eating late in the evening, and eating while working or stressed will all injure the stomach yin. An excessive consumption of spicy food and food that is hot in its energy can harm the stomach yin. Some medicines will also have an energy that injures the stomach yin. There may be a congenital tendency to have stomach yin deficiency. Invasions of exogenous pathogenic qi can penetrate to qi level or create heat in the Yangbing organs. This excess of heat can injure stomach yin. Heat from the liver can damage stomach yin over time. So now let's go to etiology of stomach yin deficiency: eating late at night, skipping meals, eating on the run, worrying while eating. Underlying accompanying pathology: stomach qi deficiency, spleen qi deficiency, spleen yin deficiency, kidney yin deficiency, stomach heat or fire or damp heat. Signs and symptoms: poor appetite with little desire to eat, constipation, dull epigastric discomfort or pain, dry lips, mouth, and throat, especially in the afternoon, slight feeling of fullness after eating, thirst, dry stool, dry scant urine, pulse floating and empty on the right middle position, rapid, fine, tongue peeled in the center, possible midline crack. Treatment principle: enrich stomach yin, harmonize the stomach. Acupuncture treatment: RAN 12 to supplement stomach yin, stomach 36 to supplement stomach qi and yin, spleen 6 to supplement stomach yin, nourishes fluids, and clears empty heat. Spleen 6 to nourish yin to clear empty heat, bladder 21 to supplement stomach and spleen qi, stomach 44 to harmonize the intestines, kidney 6 to nourish yin, spleen 3 to nourish fluids, bladder 20 to supplement the spleen, and stomach 25 to stop diarrhea, regulate intestines. Needle with supplementation. When there is stomach yin deficiency, it will be beneficial to eat foods that are wet and sticky. Things such as porridges, purees, soups, and stews will therefore nourish stomach yin. Foods that are dry in their consistency or in their energetic dynamic will do the opposite and have a negative effect on stomach yin. Foods that are drying in their energy are those that are very spicy. The spicy taste disperses and dries or have been baked in the oven for a long time. This means that a person with stomach yin deficiency should try to avoid crackers, rice cakes, toast, baked vegetables, and similar items. Deep fried and grilled foods have a very hot energy, and this can also injure stomach yin. Alcohol, too much meat, especially lamb, and spices such as chili, garlic, pepper, and so on, all have a hot dynamic which can damage stomach yin in the long term. Apart from being aware of what they eat, a person who is stomach yin deficient should pay close attention to how they eat. They should try to eat in as tranquil surroundings as possible, which means that they should not eat while working or driving, when they are stressed, or while they are doing something else. They also need to rest and not exert themselves after they have eaten. They should not eat late in the evening, and they should not eat too much at a time. Now let's talk about retention of food in the stomach. Food stagnation is often an overlooked aspect of a diagnostic picture, particularly in chronic and complex cases, where there are many patterns intertwined with each other. Food stagnation, like phlegm and blood stagnation, is often the cause and consequence of many chronic patterns of imbalance. This is because many patterns of imbalance can directly or indirectly disrupt the stomach and spleen's qi mechanism. Chronic food stagnation will also, in the long term, directly and indirectly lead to imbalances in many other places in the body. The foundation of food stagnation is often laid as early as the first year of a person's life. This will be the case if there was an improper diet and if the baby was repeatedly fed before the stomach had been emptied of food. Concept, this is due to food stagnation in the stomach and manifests as fullness, distension, and pain in the epigastrium. Key symptoms, fullness, distension, and pain in the epigastrium, foul belching, acid regurgitation, sour vomiting, and a history of improper or voracious food intake. There will often be vague and subtle signs of food stagnation rather than outright symptoms. Typically, the patient will have a slight sensation of fullness in the belly or bloating for some time after they have eaten, will burp or belch, and will have discomfort in the epigastric region. There can often be a vicious circle where food stagnation causes the creation of stomach heat, which results in a gnawing hunger. The person then eats constantly and the stomach never completely empties. So even more stagnation of food in the stomach will arise. Clinical manifestations, fullness, distension, and pain in the epigastrium, refusal of abdominal pressure, anorexia, rotten or foul belching, acid regurgitation, vomiting of sour and undigested food, distension and pain, which can be relieved after vomiting, or intestinal flatus, abdominal pain, diarrhea with a sensation of incomplete defecation and with a foul odor, or constipation, thick and sticky tongue coating, and slippery pulse. This pattern is mainly caused by irregular diet, voracious eating and drinking, or by intrinsic stomach deficiency, which halts the digestion and transit of the food. Food stagnation arises directly from eating too much at a time, eating too fast, not chewing the food properly, eating too late at night, constant snacking, eating while stressed or while working, eating while sitting in a twisted position, and eating food that is difficult to transform. If the spleen and stomach are also Qi deficient, food will not be transformed. If there is damp and phlegm, this will weaken the spleen and block the stomach and spleen Qi mechanism so that the food stagnates. Liver Qi stagnation can also disrupt the stomach and spleen Qi mechanism, with food stagnation as a result. Yang deficiency can mean that there is not enough physiological heat to transform the food. Yin deficiency and heat can lead to the formation of phlegm that will then block the stomach and spleen Qi's mechanism. So etiology for food stagnation in the stomach: overeating, eating too quickly, eating while worrying. Underlying accompanying pathology: obstruction of food in the stomach, preventing stomach Qi from descending, stomach deficient and cold, phlegm, heat, or fire in the stomach. Signs and symptoms: epigastric pain, fullness and distension, discomfort alleviated by vomiting or passing stool, nausea and vomiting of sour fluids, halitosis, sour, regurgitation, belching, insomnia, diarrhea or constipation, poor appetite. Pulse, full and slippery. Tongue, thick coating, which is either white or yellow. Treatment principle: harmonize and stimulate descending of stomach Qi, move food stagnation. Acupuncture treatment: REM 13 to subdue rebellious stomach Qi, stomach 21 to move stagnant food, stomach 45 to abduct stagnant food, calm the mind, pericardium 6 to stimulate descending of the Qi, REN 12 to supplement and harmonize stomach, REN 10 to stimulate descending of Qi, stomach 44 to clear stagnation and heat, spleen 4 to move stagnant food, stomach 19 to harmonize middle burner, kidney 21 to harmonize stomach. Needle with drainage. It is crucial that a person with food stagnation regulates the way they eat and what they eat. They should not eat too quickly or too much at a time. They should sit upright when eating and chew their food well. They should eat food that is easy to transform, and they should not eat too late in the evening. Stroking downwards with the fingers from REN 16 to REN 8 will help stomach Qi and the ingested food to descend. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial. Finally, we discuss blood stasis in the stomach. This is always a chronic pattern that will have arisen from other stomach imbalances. As blood stasis is a pathological condition that always derives from other pathological conditions, it has no specific etiology. For example, we cannot say that such and such an emotion or diet leads to blood stasis. Blood stasis normally derives from the three main conditions of chi stagnation, cold, and heat. Etiological factors which cause these three pathological conditions are therefore indirectly causes of blood stasis. This is caused by long-term spleen and stomach diseases, cold pathogen congestion, or chi stagnation, all of which lead to blood stasis in the epigastrium. Key symptoms: epigastric stabbing pain, purple tongue, and choppy pulse. Clinical manifestations: epigastric stabbing pain, which is fixed in one place, pain aggravated by pressure and more severe after meals, poor appetite, emaciation, hematemesis, vomiting, which contains blood, hemophagia, which is blood in the stool, a dark purple tongue, and a choppy pulse. The newly acquired disease appears in the channel, and the chronic disease enters into the networks or collaterals. The etiology will depend on which patterns of imbalance are involved in the generation of blood stagnation. A stabbing pain in the epigastrium and a tongue that is purple in the center are enough to diagnose stasis of blood in the stomach. Blood stasis is a very important pathology because it potentially gives rise to serious diseases such as cancer, heart disease, and stroke. For example, one cannot get carcinoma of the stomach purely from stomach chi stagnation, but one can from blood stasis in the stomach. Stasis of blood often causes a pain of stabbing or boring nature, hence the stabbing epigastric pain. This pain is much more intense than in any of the other stomach patterns. Stasis of blood always manifests with dark-colored blood, hence the vomiting of dark blood. Since the stomach is related to the large intestine, the stasis of blood extends to it and is manifested with blood in the stools. The purple tongue reflects the stasis of blood. Please note that the tongue may not necessarily be purple. If a patient has clear manifestations of blood stasis, but the tongue is not purple, it simply means that the blood stasis is not severe. So for blood stasis in the stomach, etiology: overconsumption of hot foods, smoking, overeating or eating too quickly, emotional strain, prolonged anger, frustration, and resentment, and overwork. Underlying pathology: stomach fire, retention of food in the stomach, liver qi invading the stomach. Signs and symptoms: severe stabbing epigastric pain, which is worse at night and worse for pressure, nausea and vomiting, vomiting blood, blood in the stools. Pulse is wiry, tongue is purple. Treatment principle: clear stasis, nourish blood, stimulate descending of qi. Acupuncture treatment: stomach 34 to harmonize the stomach 19 to harmonize middle burner, spleen 4 to open the chongmai, GB 34 to force liver qi, bladder 17 to clear stasis and quicken blood, Ren 11 to harmonize middle burner, regulate qi, stomach 21 to transform stagnation, Sanjiao 6 to clear heat in the three burners, pericardium 6 with spleen 4 to open the chongmai, Ren 12 to harmonize the stomach, and spleen 10 to clear stasis and quicken blood. Needle with drainage. Relevant advice: this will depend on which imbalances underlie the blood stagnation in the stomach. Thank you for your attention.